Hello and welcome to Lung Cancer Connect.
Hello, I'm Melanie MacKean. I'm a doctor who specialises in lung cancer, and I've been doing that for over 30 years now. And I've been a consultant at the Edinburgh Cancer Centre for over 20 years.
Can I start by asking a little bit about the period for patients and carers between diagnosis and treatment? And that can be a time when people get quite worried. So can you tell us a little bit about the diagnostic tests that would be required if somebody perhaps was going to be suitable for radiotherapy or chemotherapy after they've found out they've got lung cancer?
Okay, so there's three big things that we want to look at when we're thinking about lung cancer and how it's affected you. The first is you yourself, and you come with a whole set of histories and sometimes other illnesses, sometimes wishes as well, or experience of things like chemotherapy that have been bad in the past. So we really need to know about you. And that's our priority, is you. So when we talk about tests, you are the center of everything, okay? The second we start to do is radiology. A lot of radiology comes in there. And we need to know exactly where is this cancer and how much has it affected you. And we do that in a number of scans. You've probably had a chest x-ray and probably also a CT scan. Sometimes we also do scans of the head and the brain. And sometimes we need a thing called a PET scan, which is just radioactive sugar injected into the arm, tiny amount of radioactivity that's taken up by any cells that are growing fast, and so they light up. And sometimes, very sadly, that can show us that the cancer spread more than we thought it had. So a PET scan can be very helpful. And the third thing we talk about and need is a biopsy, a tissue biopsy. We're not quite at the Star Trek stage where we can just go zappy zappy and know exactly what's going on. So we need to take a sample of the cancer and we send it off to the laboratories. And there's more and more is being done on those samples, but we often need a tissue biopsy. And sometimes that'll be done if you've had a thing called a bronchoscopy, where they look down into your lungs and take a biopsy. Sometimes they do it under x-ray control. They get you to lie very still and they stick a needle in, local anesthetic, take a tissue. And sometimes they do it in other places of the body. We're getting a bit more clever. Occasionally we can even take a blood sample now for a tissue biopsy, but that's relatively new and relatively early stage at the moment. Not quite there yet, but who knows what will be in a few years' time. But we need to know what sort of cancer this is, because there are different sorts of lung cancer. And my job very much is tailoring the treatment to match you, your scans, and your biopsy. Those three things are the big things for me.
Thank you, that's very helpful. So in a sense, what you're saying is it's not about the doctor deciding on the best treatment. It's about looking at the person, looking at their cancer, and trying to work out which treatment is going to best manage the cancer and keep them well?
Absolutely. We do obviously have protocols for all of this about what we might be going to offer. But the truth is, it's absolutely your choice. You come with a whole history. You've lived an amazing life, and we want to know more about you and what you want. But the truth is, what's right for you might be different for me, might be different for anybody. So we absolutely can start to guide you what won't be of any help. And I have a phrase in my head that I keep on going over, is life is full of choices. Even when you've got cancer, lung cancer, you think, I've got no choice. You have choices. And this video is about you trying to make the best choice for you.
Can you tell us a bit more about how chemotherapy works in lung cancer and whether people can expect to feel awful from start to finish, or if it's not as toxic perhaps as it used to be?
You know, I hold my hand up here and I remember the days when we first started giving chemotherapy for lung cancer in the 1990s. And it was awful. But things have changed phenomenally in my career, even with chemotherapy. And what I see is that the drugs have become cleverer, more specific for the type of cancer you have. The drugs have become less toxic, less side effects, given as an outpatient. And the supportive medication that we give with the chemotherapy has revolutionized things. The anti-sickness drugs are so much better than we used to have. And other things, you know, we often now use something called GCSF to boost the immune system. And I think one of the things that's changed more recently that has really brought in a huge safety net are the 24-hour helplines. You know, in Scotland, for instance, we have, I think we call it the red card, but it's the systemic therapy helpline. Day or night, 3 o'clock on a Sunday morning, you've got a temperature, or you're sick, or your horrible constipation, your tummy's sore, you can phone the helpline and a specialist will be able to help you there and then and get you help if you need specialist help. So that safety net didn't used to be around. We've even got a safety net now, and things have improved because of that safety net, I think, tremendously.